patient lay down. Remember, we don't want their face to be in the view. Raise our table up. What size IR did we say we were using? Okay, length or crosswise? Either or. Okay. I'm going to work on her right leg. So I'm going to grab a right marker. And we need to have her flex her knee how much?
40 to 45.
45 degrees, okay? So if you look at from her femur to her lower leg, this is almost 90, right? This is at her knee, this forms almost a 90-degree angle. So we're going to bring her leg out some, okay? So then we need to, right there, sorry, bring our CR over. We are going to angle from inferior to superior until we form a 10 to 15 degree angle with the lower leg. And I'm going to turn this on. I don't think it'll get you in your eyes. What is my SID?
40 to 48.
40 to 48. Okay? So what I'm going to do here is I'm going to measure with my tape measure. And I'm going to hold this IR until I need to have my patient hold it. Okay? So here I'm already at 52, which is way longer than we are allowed to be. Okay? And what I'm going to look at here too is, am I centered on my IR? Am I?
I feel like in the middle, yeah, because it doesn't matter top to bottom, it only mattered left to right. Was that a different one?
It was a different one. So for this one, we do want to be centered in all directions on our CR. So we actually have to, or on our IR, excuse me. So we do need to move this down a little bit, okay? So we'll move it down. That looks better. And we're now at 56. So we have to move our SID in. However, what are we going to end up hitting?
The table.
The table.
So you gotta move the table up and then the patient down. Maybe?
So what we need to do is start with our patient close to the end of the table. So I'm going to have you scoot down. Be careful not to pick the pollinator box. Thank you. Okay. So I'm going to reset her leg flexion back to 45 degrees. Okay. I'm going to move this back just a little bit so it doesn't touch her toes. Okay. Now, if I come back into that position, that looks better. And I'm at 43 and a half there, which is in our range now, right?
Mm-hmm.
Okay. So, kind of happy there. That's all I'm going to do. You okay? Mm-hmm. That's all I'm going to do for right now. I'm going to measure my SID and make sure that I can center on my IR. The next thing I'm going to do is I'm going to come back here and I'm going to try to line up my tube or my anatomy and our CR. So where are we centering for this one?
Superior to the tangential or to the patellofemoral joint?
The patellofemoral joint space. So you find the apex of the knee, okay? You find the little fat pads on either side of the patella, and we're going to center right at that level and midway between the medial and the lateral border, okay? Now, let's put our IR up here again. Okay. We need to match our CR angle. And actually, this is not going to be close enough to what we need, okay? We need to angle just a little bit more because that was only a 6-degree angle, which isn't enough to form that 10 to 15 degree angle with our IR, or with our lower leg, okay? So, remember that a 10-degree angle isn't very much. So I'm going to put this so this bottom line is parallel with my lower leg, and then I want to see that my CR is perpendicular with this line that we have here, which I think we're pretty close. If not, we might need to go up just a little bit, but it's a 10 to 15 degree angle. Okay. So here, we've actually gone up 15 degrees from perpendicular. Okay. So we're at 105 for our tube angle. So I'm gonna realign, find my crosshair, actually I already did that, sorry. Okay. Bring my IR back up here. Are we supposed to shield her?
Yes.
Yes, for this one, okay? The marker always goes lateral. Okay. We're gonna collimate a lot. Once we make sure that our IR and our CR are aligned, we're gonna collimate down pretty small. Alright. Okay, so now, no rotation, make sure her leg's nice and straight, and then we're gonna have her bring her hands up here, and if you can hold it just like that. Good. And we have tilted the IR so that it matches the angle of the CR. So our CR and our IR are perpendicular here. Okay, I'm gonna bring this. Can you bring this up a little bit? Can you hold it like that? Okay, got it? Mm-hmm. Okay, so she let it slip down her leg a little bit, so we weren't quite centered on the IR anymore. Remember how I said this could be lengthwise or crosswise? So if your patient's having a hard time holding it like this, go ahead and let go. Flip it around. Give them a little bit extra hold on too. Now try that. Better? Mm-hmm. Okay. So angle it forward just a little bit. Okay. Come up just a tiny bit. Got it? Mm-hmm. Okay. Alright, so now we're centered on our IR again, and we've turned it lengthwise just to give her a little bit extra so that she can hold on a little easier at the bottom. So after we shield her, what are her breathing instructions?
Don't
so
move.
Just to hold still, okay? Alright, any questions about that one? Excuse me. Okay, so this time we're going to have the Houston method, right?
Yes.
Okay.
Which one? I don't know what you wanted. I didn't see gauze.
What size IR are we using?
10 by 12.
10 by 12, okay. So I'm going to have her move her unaffected leg to the side just a little bit. You don't have to roll. And then we're going to lift this up. I'm going to put your knee, this IR underneath your knee. There we go. Okay. Alright, so we know we need what angle for this one?
10 to 15 CR angle, but
No, 40 to 45.
40 to 45 degrees
from the
cephalic.
lower leg.
Yeah. It's going to create a 10 to 15 degree angle from the lower leg. Okay? So, if, let's say we're going to flex, or we're going to angle, 40 degrees, what does our SID need to be?
40 degrees, 80, 30.
9, 31.
It's 8. So 32. Okay, so 5 degrees. Every 5 degrees, it's 1 inch. Okay, so 40 divided by 8 is 5, or 40 divided by 5 is 8. So we're going to drop it to 32 inch SID. You're going to bring your CR directly over your IR, measure your SID to your IR. Okay, 32. So we need a 40 degree cephalic angle. Okay, now don't use your vertical button and don't use your universal buttons. Use your directional buttons. Okay. How much are we flexing her leg?
55 degrees slowly.
55 degrees, okay? So what I like to do, come all the way up to 45 degrees, and then just remember we measured 10 degrees earlier. It's really small, so just bring her back up about 10 degrees past to 55, okay? Now, we need to look for those crosshairs. Where do they need to be centered?
Not on the foot.
Not on the foot.
Patella femoral joint.
PF joint.
So, we need to be centered to the femoral patellar joint space, okay? If you notice, the CR is right around the angle or the area of her joint space, but our light is on her foot. What could we have her do? Yeah, so have her point her toes actually. There you go. Okay, now her knee joint is unsuperimposed. Where are we centering again, we said?
PF joint.
Let's not use that because everybody's watching this video. So the patellofemoral joint space, okay? So we're still gonna feel for those fat pads on either side of the apex of the patella. We need to line up our tube and IR, so I'm gonna open my collimation. I'm gonna help her, I'm gonna lift her leg up just a little bit, there you go. Point your toe for me. There you go, good. Collimate. Marker's gonna go on the lateral side. And after we shield her, what are her breathing instructions gonna be?
Don't move still.
Don't move, hold still, okay? Now your images show you the patient using what to hold their leg still?
Towel.
A gauze, towel, anything that's kind of long so that your patient can hold on to it.
So I have to be like this.
Yeah, but hopefully it would be down here so it would be long enough for you. Okay, one thing that I like to use, good catch. One thing that I like to use are these sponges, okay? Especially if your patient needs to point their toes, okay? You can have them kind of rest on here. The one thing that I want you to keep in mind though is that this sponge needs to not superimpose your shadow of your knee, okay? Because not all of them are so radiolucent. Sometimes the seams show up. So if it's covering your marker, like this one is, that's okay. It's not in the joint space because your marker shouldn't be in the joint space, right? But you can't put it like this, okay? Because that will completely superimpose your anatomy of interest. So you can maybe set it on the side there to help your patient just a little bit so they can hold still. Okay? Any questions about the Houston method?